Hello, good afternoon, everybody. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They seem like freckle, like spots forming large black patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across 4 Indian cities, reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. Then this can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know more about melasma from an expert. So let's connect today with our skin expert, Dr. Karthik Sunki, live from Hyderabad to talk on how to overcome melasma. Dr. Karthik has completed his MD DVD specialization in dermatology at one of the most prestigious institutes of the country, Osmania Medical College. Dr. Karthik is currently practicing at Soumya Skin Clinic, Hyderabad. Dr. Karthik has presented many papers and posters in various national and international conferences. Also, he has many articles published in national and international journals. A very warm welcome to you, Dr. Karthik.
Thank you, Samika, for your introduction.
So, doctor, today we are going to talk about a very common chronic skin condition, especially in India and especially in women, that is melasma. And to start with, first of all, we would like you to tell us what is melasma, because in India, at least, we see so many women, especially in the age group of 40 to 65, suffering from melasma or hyperpigmentation issues. So, first of all, we would like you to begin with by telling us what is melasma, doctor.
Yes, melasma is the common pigmentation seen over the face, usually in the malar area, sometimes in the mandibular area, cheek, upper lip, and eyebrows. It is most commonly seen in the age group above 40 or near 40s. It is usually seen as dark colored brown pigmentation. So sometimes it can be gray also, depending on the layer of the pigment. Yes. And usually it is a very difficult thing for females, usually most commonly seen in females. So it is very recurrent condition. So most of them will be facing this problem.
Right. And as it is associated with the appearance part, we can, imagine that women who are suffering from melasma are really confused, or many a times they are misinformed as well, because commonly it is said that you are aging, so you are bound to have hyperpigmentary issues. We'll talk about it as well, doctor. But before that, what are the causes of melasma?
See, there are few conditions where we see melasma most commonly. See, first thing, the age. It usually starts around 40s, so it can be due to hormonal changes, which can increase the sensitivity of the skin to sunlight. And the second thing, it is most commonly seen in the fair skinned people. Those who are fair skinned, the melasma usually occurs even in the early stages also. And third thing, people who have thyroid diseases are also more are at increased risk of developing melasma. So these are the usually most common conditions where we see melasma. And usually it is females have the tendency of developing the melasma around 4 times more than males. So yes.
Right. So females, anyways, are at the risk factor. They are at the risk of, getting melasma. The chances are more than males.
Yes, yes.
Now, doctor, whenever we talk of these dark patches on our face, we often call them pigmentary issues or hyperpigmentation. So,
Right.
melasma, hyperpigmentation, are they the same or is there any difference?
So, there is a difference between hyperpigmentation and melasma. Yes,
Mhm.
we can call melasma as hyperpigmentation also, but not all hyperpigmentation condition or not melasma. See, we can get hyperpigmentation secondary to other kind of issues like acne or any trauma or so even tanning, excessive tanning, or all these conditions of hyperpigmentation. But in melasma, what we see is that there is a difference between there are like melasma is categorized into two categories, like the depending on the depth of the melanin deposition. Melanin is the pigment which induces the color to our skin. So melasma, we can have the superficial part and the deep part.
Right. So we can say that
Or,
hyperpigmentation is a broader term. Melasma falls under it. So melasma is hyperpigmentation, but all kinds of hyperpigmentation can be melasma.
yes.
Right, doctor. And doctor, what are the symptoms? Are there any symptoms associated with melasma, or it's just the sign, the patches or freckles that are formed on our skin?
See, usually it starts as a small brownish color pigmentation over the cheeks and nose. That is the most commonly observed pattern. See, initially it starts as a small few patches. Later
Okay.
on, it can spread over the entire cheek and all. So it's better if someone sees a small patch on their cheek or nose, then they should be careful and they should get it treated. It should be
Right.
at
Right. So it's not
that's
that
very common.
right. So it grows or it increases gradually, right? I can't get melasma overnight. I mean,
No,
what I can see are those small patches. They
yes.
will gradually increase and become more prominent. Okay. Now, doctor, you were saying that women are more at risk for having melasma than those who are exposed under the sun, or their sun is also a very big reason of getting melasma. There are other factors as well. For example, if somebody is having a family history, etc. Now, what are the risk factors for melasma, doctor? Apart from these, who all are at risk of getting melasma?
See, first thing, women, they are more, they are at risk of developing melasma.
Mhm.
Second, the age around 40s or above 40s, definitely they are at risk. Third, fair skinned people. And fourth, the medical conditions which we have discussed, like thyroid issues, and other people who are using the OCPs, they are at more
Okay.
risk of developing
Oral
melasma.
contraceptive
Or,
pills, those
yeah,
one.
oral contrast.
Okay. Yes,
Yes,
yes, yes. So
these are the.
hormonal changes, they are equally responsible and they can cause melasma?
Yes, hormonal changes is also a main factor because around 40s there will be hormonal changes in a woman body. So that increases sensitivity of the skin to the light. So that is the main reason for developing a melasma. And not only the conditions which we have discussed, the factors, and also if a woman when she's pregnant, they can develop hyperpigmentation also. That is called cloasma. It is similar to melasma, but it is temporary. Only during
Okay.
pregnancy they can see that, and it will usually fade away after the delivery.
Okay. So nothing
Then
to
we
worry if a woman is getting it during her pregnancy. It's
yes,
temporary and it will gradually fade away.
yes.
Okay. Now, as a doctor, how do you diagnose, doctor, when a patient comes to you? Just by the physical, examination, you can tell that this is melasma, or other techniques are also there.
No, usually we can diagnose the melasma by clinical examination. We need not have to go for any other tests unless and until if there is an underlying condition which is triggering it. So we usually don't prescribe any tests
Okay,
for
okay. So
melasma.
just by clinical
Clinical.
examination, you can tell that this is melasma. Right.
Yes,
We often say, especially in medical field, that prevention is always better than cure. Any way we can prevent melasma, doctor?
definitely. We can prevent it by using a sunscreen regularly. Not only sunscreen, moisturizer is also an important part. See, hydrating your skin and protecting your skin with a sunscreen are two most important things.
Okay. So, taking good care of our skin, having a good skincare routine, which includes sunscreen and moisturizer, is what we need. Now, when we talk about sunscreen, doctor, the first thing is that many people avoid or ignore using sunscreen despite knowing that sunscreens are really important. Saying that, it makes our skin oily, or I sweat a lot of after using sunscreen, or I get that white cast, etc., etc. How you as a doctor address to all these, complaints that people normally have with sunscreen?
Yes, usually these are the regular complaints which we hear a lot. But there are a few sunscreens. Actually, there are many sunscreens, very good sunscreens, and one sunscreen doesn't suit every person. So we will have to find out a product which suits our skin. Then we will have to select. So some people prefer the white cast thing.
Hmm.
Some people prefer the oily appearance, not the oily appearance, but they like the shiny skin.
Right.
So there is a preference for everyone.
Mhm.
So we have to check for what they prefer and suggest a sunscreen with what we know or what with our experience. So usually tinted sunscreens are one of the popular choice which we use in melasma because it can one thing it can cover up the already existing hyperpigmented patch, and second, tinted with matte finish is something which most of them prefer. It doesn't. It is there are many non-greasy, non-oily sunscreens, but one thing we will have to agree is that any sunscreen will be oily at the end of the day. But how much oily is we will have to decide.
Right. And then, as you said, that there are so many formulations and kinds of sunscreen available that we actually can, choose the right one as per our skin type or the working conditions, etc. Now, a very common, myth regarding sunscreen is that it says, the name itself says sunscreen, and my exposure under the sun is hardly, anything. So why should I use sunscreen, especially women, because mostly they are, working from home or working inside the home, are homemakers, and they'll keep on saying that, I'm not going out under the sun. Why should I use sunscreen?
Yes, this is again one of the most common thing we face.
Yes.
See, first of all, sunscreen is not something which we have to use when we go out in sun. We will have to use it regularly. The reason is that we can't avoid sun exposure in our day-to-day life. Even if we stay indoors, there is light coming from windows, doors, and some part to some part, not sun, from the tube lights and all the electronic screens and all. The main thing which is causing the hyperpigmentation in melasma is UV radiation. So there are UVA, UVB rays most commonly in our atmosphere. So UVA is it can't penetrate the glass; it stays away, which we are exposed when we are outside the like in the direct sunlight. When we are in direct sunlight, we get UVA and UVB. But UVB radiation can penetrate the glass windows. It can come into our homes when we are sitting inside our home or offices. So we need to apply sunscreen daily, even if we are indoors, and when we are using our appliances also, like in the laptops and mobile screens, Yes.
Right. So that even if the name suggests sunscreen, it does not only protect us from the harmful rays emitted from the sun, but also the other harmful rays emitted from the devices, LED lights, laptops, etc., etc. So needless, no matter whether you are working from your home or your office or going out, you need to use sunscreen. Now, with sunscreen, whenever we go as a common man to buy sunscreens, there's this SPF. What is SPF, doctor, and how to decide, what SPF is suitable for our conditions?
So SPF stands for sun protection factor. So it determines the level of protection which we get from the sun. So when we apply it, like usually 30 SPF can protect us from 97% of these sun rays, but it has a catch. So the time of protection is also important. So usually these sunscreens can protect us from sun for maybe 3 to 4 hours in a usual way. So reapplying a sunscreen is most important.
Okay.
Not only the number doesn't. If you increase the number, the protection rate increases. Once daily application is not uh, uh, acceptable, but we will have to use it like every 3 to 4 hours.
Okay. And still, in general, if we want to talk about if somebody who's, exposure under the sun or, in normal conditions, he or she is working, what should be the SPF that one should go for?
Minimum SPF should be 30.
30.
Yes.
Okay, fair enough. And as you said, the reapplication part is very important. More than SPF, it's the reapplication that is important. So we would like you to shed some more light upon how to use sunscreen A, how much amount to take, because again, there is, conflict. Many people will use very small quantity. Then we have this two-finger rules, etc., etc. So, what is the exact? How much should we use, and how often should we reapply?
So first thing, the sunscreen should be used every day, even if you're home indoors, even if it is raining outside, cloudy day, or any day. It should be applied 365 days compulsory. And second thing, coming to the quantity, how much we apply. Usually fingertip units. We should apply all over the face and neck. It should be
Okay.
from always.
Mhm.
And third thing, uh, the reapplication part. So reapplication should be for every 3 to 4 hours. That is the usual thing for our Indian skin and Indian climate. And if we are going out, if we are in the sun or traveling a lot, we are sweating a lot. Or if we are in a beach, if we are having a holiday in beach seashores, then we sweat a lot. Whenever there is sweating or wash off of the sunscreen, we should reapply it immediately.
Okay.
So it all depends on what we are doing, where we are. Yes.
Exactly. And whenever we go out buying a sunscreen, as I said, SPF is there. But apart from SPF, because you have already explained what SPF is, there are so many other informations also on the box. Like it's broad spectrum or not, PA plus plus plus, and so many other things are also there. What are the basics that we should look for?
See, there are first basic thing is SPF. It should be 30 or more than 30. 30 is good. More than 30 is also okay. And second thing, we can go for a broad spectrum. PA plus plus. It should be more than 3 PA plus plus plus. And broad spectrum. There are three types of sunscreens, like physical, chemical, and broad spectrum. So yes. So physical sunscreens you can apply it immediately before going out. But the most common side effect with physical sunscreens are they leave white cast. There will be the residue white casting. So that depends on the person's preference. And it is if you are going out having this like sports day, or we are in the ground or mostly in the sun, then they can use physical sunscreen, or even sensitive people can use physical sunscreens. And chemical sunscreens, most of them are like broad spectrum nowadays. So broad spectrum is good enough. They can use it. We have many options in them, like gel based, cream based, and the lotion based. So that one in broad spectrum, we will have to apply it 30 minutes before we go. So that are the most uh, important things which we see in sunscreens.
Right. So these are the basics that we can look for whenever we are out buying a sunscreen. So as you said, prevention is better than cure, and nothing better than applying a sunscreen regularly. Religiously, reapplication is also very important. Now, as we are talking about melasma, doctor, how do you treat melasma? What are the treatment options available for melasma?
So we start with the basic things, like we start with the moisturizer, first repairing the skin barrier, moisturizer, sunscreen. See, even these can come under the treatment part. And the third thing, we use depigmenting agents at the night time. So we start with the hydroquinone and kojic acid combinations. There are many things. So hydroquinone, kojic acid, vitamin C, and all. So yes. Then usually we start as an initial therapy for 20 to 30 days, where we use a stronger depigmenting creams. Then we go into a maintenance phase where we have to maintain the results for next 3 months.
Okay.
So it's
Now,
not
as we
about
are discussing, yes, yes. As we are discussing the treatment part, I'll pick up some of the questions that our viewers are asking related to the treatment. Dr. Kirti Kapoor is here asking, how often should I see a dermatologist to monitor my melasma and ensure that my treatment plans is still effective?
fine. For the initial days, you can we can go in review for every 30 days. Then if it is under control, if the pigmentation has come down, then you can come every second month.
Okay,
Yes.
right. So trusting your doctor and following up is really
Following up
important.
is a very key point. Actually, because there is high chances of recurrences in melasma.
Okay.
Once the pigmentation get reduced, then it can increase suddenly. So following up is most important part. That depends from person to person. Usually, some people might not come from 3 months. Also, they will be very good. But most of the times which we see in our practice, we ask them to come initially after 20 days, then after every month for next 3
Okay.
months.
And
Yes.
a very common question when it comes to melasma, I'm sure your patients also ask the same. Will it permanently go away? Will I get rid of it permanently?
Yes. Actually, the answer to the question is simple answer is yes.
Okay.
But there are conditions where the pigmentation can be difficult to go. Like as you said, as I said, there are like the two layers of skin where the pigment get deposited. The upper layer epidermis and the deeper layers in the dermis. When the pigmentation is in the deeper layers, these creams can't help much. So superficial pigmentation can reduce very in a very good way. But when there is deep pigmentation, we need some procedures to uh, we use lasers to remove them, and it will definitely go away, but it will take some time. We will have to be patient, both the doctor and the patient. So timing and patience are two key things.
Right. Now, the thing is, doctor, which is the practical scenario in our society, that whenever we encounter something like this, something like melasma, hyperpigmentation, we'll first go and try some home remedies. We'll apply curd or papaya extract, etc., etc. If that doesn't work, that we'll talk to some of our friends or relatives, who also
Yes.
had the similar conditions. Then we'll go over the counter, ask the chemist, I'm having these
Right.
pigmentary issues. Please advise me something. When all this fails, when the condition gets out of control, is when we go and land up in front of a doctor. This is a very common general, practice that people do. Now, your take on the home remedies, or asking a friend and family, or over-the-counter medication. Is it okay to go for all these, or it will make the condition even worse?
Definitely no. Uh, see, all are not same. Few people can try things. Usually, they do try a lot of things and they come back to us. But using those things are not very safe.
Okay.
You can't say who. I mean, who is sensitive to what cream or home remedies they use. If they get a reaction to those things, that will be more devastating than having a pigmentation over their face. So definitely, I don't recommend them to try anything in the home, or definitely not something which their friends or family members have to use. And taking something from the over-the-counter medical shop or products, they might reduce the things. Sometimes they can reduce the things very faster than what we give, but those things usually contain steroids or not. So that will be more damage. Those things cause more damage on the long term than what results they get from these in the short term.
Right.
Those are very harmful.
Right. So we should not waste our time, energy, money, etc., and going for those home remedies, or asking a friend or family, or going for over-the-counter medication. It can be really, really harmful and dangerous. Please don't do experiments on your skin. Go and consult a qualified doctor. That's really important. I'll take few more questions from our viewers. John Burgess is here. His question is, are there any natural or alternative treatments for melasma that I can try in addition to or instead of the conventional treatments?
Okay. So he wants, like, there are other options, like there is medical management where we use creams and depigmenting creams and all. Secondly, if we can use procedures like chemical peeling, lasers, which can reduce the pigmentation. And there are also few new studies showing the PRP, facial PRP, which can reduce the pigmentation. Injecting tranexamic acid into the spots can reduce the pigmentation. But these are few new things, but those are experimental are now.
Right.
Established
Faria,
chemical
yes.
chemical peeling and lasers are two established treatment options for melasma, other than the creams and uh, tablets.
Right, right. So a lot of advancement is also taking in the field of dermatology, right? Faria Beg is here asking, are there any medications or supplements that I should avoid while taking the treatment of melasma?
So when you're using only topicals, you need not have to worry about taking any medication, because most of them are the creams. They won't penetrate inside. Most of them doesn't have any side effects or interactions with other things. Sometimes we use oral medications, which you will have to discuss with your prescribing doctor, dermatologist. Uh, Tranexamic acid is what we use orally, these types. So if any person who is having DVT or deep vein thrombosis, then they should definitely avoid, or any cardiac issues, then they will have to avoid these kind of medications. Other than that, it is very safe treatment. Using creams and ointments doesn't affect any other medication which you are using currently.
Fair enough. And melasma, as we were talking from the beginning, that is also associated with age. If you're aging, then the chances are more that you'll get melasma. If you're a woman, then of course the chances are even more that you'll get melasma, etc., etc. Now the thing is that people often feel that as it is associated with age, I'm bound to have it. It will happen, and there is no way out. So uh, I'm asking this question to you, doctor, because many a times, women ignore or they just avoid, okay, I'm having it, there's no way out, it will happen. So why should I go and consult a doctor? So my
Yes.
question to you is, what's your stand on this, phrase that as it is associated with the age, you are bound to have it, there's no way out, and why it's important to go and consult the dermatologist or a qualified, doctor expert at the very first place whenever we see these patches.
So, first of all, what you said, the thing of it is bound to happen and it will happen is, yes, that is true. But having that feeling is not right. So you will have to treat it properly. Whenever you see the first sign of pigmentation on your face, melasma can be treated and can be prevented if we uh, consult early and use proper medication, use sun protection. We can definitely prevent it. It is not that you are a woman and you are aging, you need to have melasma. You need to
Right.
go through stage compulsory. Definitely, it can be prevented, but you need to be more careful and you need to be more observant to know that signs of the pigmentation early, and you need to treat it properly. Definitely, we
Right.
can prevent melasma.
Yeah, the whole purpose of having this session is actually to spread awareness about melasma and how to control it. And the very basic is that in case you see these signs, of melasma, the freckles, spots, etc., please go and consult the right person, an expert, which is a qualified dermatologist in this case. Don't fall prey to the influencers on social media or the market gimmick, the OTT products, etc. Go and consult a qualified dermatologist. As soon as you go there, the chances are more that you'll be treated early, and the treatment length would be really quicker. So that's the whole idea. Now, doctor, when we were talking about sunscreen and moisturizer, we talked a lot about sunscreen and how to use it, why it's so essential. We would also like you to throw some light over the use of moisturizer. You said it's very important to keep your skin hydrated. Now, the thing is that many times, okay, those who have dry skin will use sunscreen, but then those who are, oily skin or acne prone skin, they'll say that I don't need moisturizer. I'm anyways producing a lot of oil. So, what's your take on that? Why moisturizing for everybody is important?
See, moisturizer, it should moisturizer and sunscreen. These are two main important things which everyone and every skin type people can use. Even a dry skin person or a mixed skin type or a oily skin person, all of them need moisturizer. The thing with the oily skin people is that they, as you said, I mean, uh, they think that they don't need again moisturizer because their skin is excessive oily. But the skin, there is one thing called skin barrier. That functioning will be disrupted when you use the other products, or when there is a skin barrier defect. The person definitely need moisturizer other than the oil secretions which he is already secreting. So every person, even an oily skin person, should moisturize his skin. There are again, that depends. Again, one moisturizer doesn't suit everyone. So there are
Right.
different kinds of moisturizer, gel-based, cream, lotion. Something will help him out. The only problem with the oily skin people is that their skin will be excessively, oily. So they don't prefer to apply the moisturizer. Usually they can apply gel based moisturizer. That will be very good and it will be helpful. But a moisturizer is definitely recommended for every skin type.
Right. So moisturizer, sunscreen, they all are equally important. What we need to do is to choose them as per our skin type. And for that, again, doctor, we can take the help of a dermat. We can go and
Definitely.
ask that, I need to have a good moisturizer. What is my skin type, first of all? And then as per that, you can prescribe the sunscreen and the cream, right?
Yes.
Okay. Now, as we were talking about sunscreens, okay, sunscreen usage is one. along with the sunscreen, can we also use the physical barriers? People use hats and scarves, etc. Will that give some extra protection?
Yes, definitely. Physical protection, I mean, physical barrier protection is first of most important aspect. First thing in sun protection part, physical barrier function is the first thing. Like we can use an umbrellas, scarves, broad-braced hats. These are few things which you usually use. And second comes our sunscreen. It can protect directly from our skin. So physical protection is always more important, is equally important as your sunscreen.
Right. So use sunscreen. Don't miss out on your sunscreen, even if you are using a physical barrier. But along with that, use a physical barrier, umbrella, wide rim, hat, etc. Scarves also can be used. Neha Sharma is here asking, what are the possible causes of melasma, and am I at risk for developing it?
Uh, yes, as I told you, the causes of melasma can is due to the sunlight, UV radiation. UV radiation can induce pigmentation in uh, in people who are around 40s or fair skin people. Again, all those things, thyroid issues and hormonal issues, people with hormonal issues. Uh, yes, that depends. Is she at a risk of developing hyperpigmentation or melasma? That depends on her age, the skin type, the color, and also if there is any family history and any medication she uses. These are few things which you will have to check for.
Right.
Usually, yes.
Yes. And doctor, those who have a family history, for example, if my parents or any of my parents had, melasma, what can I do to prevent having melasma?
So, see, simply when you have a family history, then there is obviously increased risk of developing melasma. So you will have to use you protect your skin. Yes, then use a sunscreen, moisturizer, and a sunscreen regularly.
Okay. So moisturizer and the sunscreen goes really a long way in protecting us from, having melasma. So use it religiously, regularly. Now, doctor, anything that we missed out on, or anything that you would like to add, or many times, because you come through so many patients, and many times you see that they have already committed some mistakes or delay in, consulting a doctor or OTT products, etc. So, what are the most common mistakes that people occur after having melasma? If which we should be aware of.
Yes. First thing, uh, when you notice a brown spot on your face, cheeks or nose, anywhere on the face, you should definitely take care of it. You should consult a dermatologist, diagnose it, and uh, get it treated. And you should have patience. Definitely, it is a long. It takes long time to reduce the pigment and maintain it. So you will have to be patient. It can take anywhere between 2 to 6 months. So following up with the treatment is most important, and being patient and following up, using everything which your doctor has prescribed should be a main thing. And first thing, ignore those things that can turn into a the patch can increase into a bigger size, and it can almost spread all over the face. We have seen many patients who has melasma all over the face, like even on the forehead, cheeks, nose, mandibular area, upper lip. So when it gets into a difficult or more widespread thing, it will take a lot of time. So when it is a small spot, you can reduce it immediately. And when there is a large area involved, the self-esteem or self-confidence of the person will be reduced.
Right.
So the importance of treating it in the small or early stages is very important. First
Right.
thing, treating it early as possible is important. It will take time. It will take time. So, being patient and waiting with the treatment course is second most important part. And of course, the main thing, using moisturizer and sunscreen is most.
Right. And before we sum up, one last question from a viewer. Shania Sain is asking, can melasma appear overnight?
No.
It will grow
Think
gradually.
any other thing rather than a melasma.
Okay. Now we are almost at the time where we are going to sum up this session. Any take-home message for our viewers, Doctor?
Yes. So melasma, first thing, the melasma can be prevented provided you use the sunscreen and moisturizer regularly. Second thing, whenever you see a small spot or small pigmentation over your face, definitely consult your dermatologist and take proper treatment. And be patient with the treatment course. It can take anywhere between 2 to 6 months. So be patient. Yes, those are main things. And
Right.
protect your skin. Even whether you have melasma or any other pigmentary issues or anything, using a moisturizer and a sunscreen regularly will have more effects. I mean, more advantages, not only in melasma, in general condition also. It can prevent. It can be used as anti-aging product.
Right. Thank you so very much, Dr. Karthik Sunki, for your valuable time. So it was a very informative session for our viewers. It was wonderful hearing you. Thank you so very much.
Thank you.
And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Take care, have a good day ahead, and keep glowing.